FitWits with a group of physicians and teachers and parents, and we had a conversation about what we could do to create change around the obesity epidemic. And FitWits is a cast of characters. We've called the FitWits and the Nitwits, and they're character-driven stories. So we use the characters to help kids understand how to talk about obesity and obesity-related diseases. They find their way into games. So the games are embedded with challenges and a level of competition for the various players. We're in schools, so we work within schools in the Pittsburgh area. We have a partnership with a family medicine residency program that's run by University of Pittsburgh St. Margaret's Hospitals. And we're also working with the physicians on a series of tools that doctors can use to start conversations with patients about obesity. We focus a lot on portion size and how you can use your hand as a portion guide. We just finished a 6-month game in a school in McKeesport, Pennsylvania, and the idea was looking at ways that we could create sort of a choose-your-own health adventure. And kids would take home challenges that had health-related content that they would do with their friends, their family. And we also worked with teachers and figuring out ways that we could get teachers to think about integrating health into things like math, science, and reading. And I think what we learned from that game is ways that we could change a school culture. So could we look at designing a game that would allow a school to make changes around health policies? And the incredible thing about that game was we really started to see different conversations happening in the school. We saw parents get more active. They wanted to volunteer. We started a school garden. Parents were able to come in, actually keep the school garden running over the summer. We had teachers that were able to integrate core ideas around health into science, into math. So I think we're really encouraged by the long-term changes that we're seeing as we're developing game platforms that allow for more long-term changes, because we know it takes a very long time to change behavior. And with the FitWits MD tools, we've understood that we've broken down a lot of barriers between the doctor and the patient, where conversations around obesity maybe weren't happening. Conversations have actually started. So doctors are actually talking for 2 or 3 minutes about obesity and nutrition. And when conversations that were occurring in the doctor's offices that were maybe lasting 3 or 4 minutes, the FitWits tools enabled the conversation to continue on for about 7 or 8 minutes. So they really provided a new level of sort of comfort and competency, and I guess, improved the relationship between the physician and the child and the family member that's usually accompanying the child. I think what we've learned is the community network. So we've really created kind of a networked system within communities. So we're looking at this idea of a FitWits zone. So within a zone, in an urban area, we haven't actually worked in a rural area, is you have the family physician, you have a school, you've got a community center, you have churches, you have places where people are making decisions about shopping, and that through this network you can begin to connect health resources and positive health messaging.